Good day everyone, I am Jim Surigao and today I'll be assessing the cardiovascular system. So the cardiovascular system is an organ system that permits blood to circulate and transport nutrients, oxygen, carbon dioxide, hormones, and blood cells. So it provides nourishment, fight diseases, stabilizes temperature, and maintains homeostasis. So first thing that I'm going to do is review my client's previous medical records if available. So this allows me to get the previous medical history and basic information about the client. So next is to determine the scope of the assessment needed so that I can prepare the necessary equipment. So we have here the pen light as a tangential light source, a stethoscope to auscultate heart sounds, and rectangular cord, and a ruler to measure the patient's jugular venous pressure. And now, I'm going to perform hand hygiene to prevent the spread of microorganisms. And don my gloves. So, good day, ma'am. I am Dean Surigao, this field nurse for today. May I see your hand, ma'am? And please state your full name
Tiffany Baylor,
and your age,
19,
your birthday.
January 5, 2004.
Okay, thank you. So, ma'am, today I'll just explain the procedure that I'll be doing to you. I'll be assessing your cardiovascular system, which means I'll have to listen for your heart sounds and check for the pulse on your neck, arms, and legs. And for me to be able to assess that I'm going to touch certain parts of your body. And I'll be palpating your neck and your peripheral limbs, your arms, and your leg. So, is that okay with you, ma'am?
Yes.
So, do you have any questions or clarifications before we proceed our assessment?
None so far.
So, rest assured that all the documents and findings are completely confidential to me and the attending physician. So, how do you feel today, ma'am?
I feel okay.
Okay. So, have you experienced difficulty of breathing?
No.
Have you had any history of heart diseases?
No.
Do you smoke?
No.
Okay, thank you. So let's start the assessment of the jugular vein and carotid arteries. The first thing we need to do is position the client supine with the head elevated between 30 to 45 degrees to promote normal breathing during the procedure. So ma'am, now I get your side and I'll be shining my pen light to check for your neck, suprasternal notch, and around the clavicles to observe for any pulsations or shadows. Ma'am, please can you tilt your head to the left? Okay, direct to the left. Okay, can you now relax? Okay, so the right external vein is flat and without distension. And now, I need to assess for the jugular venous pressure by locating the highest visible point of distension of the internal jugular vein. The jugular vein should not be distended, bulging, or protruding at 45 degrees or greater if so. It may indicate a right-sided heart failure. So, alright. So this time, I'll be measuring your jugular veins, ma'am, by measuring the sternal angle by using the rectangular cord and ruler. Okay, can you please tilt your head to the left? begin your carotid artery slam. Now can you tilt your head to the left? Okay, turn to the right. And now, I'll be auscultating your coronary artery using the bell of the stethoscope so that I can hear the low pitch sounds. Ma'am, so can you tilt your head to the left?
Yes.
Tilt to the right. Okay, right. So for the next part of the assessment, I'll be inspecting and palpating your pericardium or the chest area. And I need you to expose the grape from one to chest to the other. Then I'll be inspecting your chest for any abnormal pulsations in your aortic, pulmonic, tricuspid, and also the apical areas. Now, let's palpate for hips and lips. So, I'm going to place my fingertips on your sternal border under the apex. So, and this time, I'll be palpating for trills or the vibratory caused by the turbulent flow on your chest. So I'll be using the ball of my hand to palpate. Next is I'm going to palpate the apical impulse using the palmar surface of 2 to 3 middle fingers. Then, next thing I will inspect and palpate the epigastric area at the base of the sternum for abdominal aortic pulsations. So, next, I'll be auscultating your heart rate and rhythm using the diaphragm of my stethoscope to at the apex. So your heart rate and rhythm are regular, and your heart rate is 65 beats per minute, which is in the group, which is the normal rate. Now I'll be auscultating for the high pitch sounds, the aortic, pulmonic, and also now the tricuspid and the apical or the mitral for heart sounds, extra heart sounds, and more using the diaphragm of the stethoscope. And repeat using the bell for the low pitch sounds, then repeat the process, which is the right. while the patient in a left lateral position, in a sitting position. Okay. Ma'am, can you please fill in the left side? So, okay, for the next part of the assessment, I'll be assessing the peripheral vascular system. So, ma'am, can I have your eyes? I'll be inspecting for any lesions on the skin and also the skin discoloration and symmetry of your arms, and I'll be palpating using the dorsal surface of my hand for skin temperature. So the temperature of the skin is warm to touch. Independent position of lips, there is an extension of the veins, and when it's elevated, the veins collapse. So this time, I'll be palpating for your brachial pulse, ulnar pulse, and also the brachial pulse bilaterally. So next is I'm going to check for the capillary refill. So I need to check the capillary refill. So the capillary refill is less than 2 seconds. Now I'll be performing Allen's test, which I'm going to tell my patient to close your hands and open quickly as you can. Now, if I'm going to say squeeze, you're going to stop your hand, okay? Okay. Start. Squeeze. Again. Squeeze. Start. Squeeze. Alright, now that we are done with the upper extremities, we'll be moving on. So now, I'll be assessing your peripheral vascular system in your lower extremities. So, I'm going to grip the I'll be observing the symmetry of your lens. Now, the skin for any lesions, hair distribution, and also the skin temperature. And I'm going to check for any signs of edema. Just relax lang. So no lesions, and the skin is warm to touch, and hair is properly distributed. So alright. So independent position limbs, there is an extension of the veins, but when it's elevated, the veins collapse. So next, I'll be palpating for a femoral pulse, popliteal pulse, and the dorsal pedis and posterior tibialis. Okay. Yeah. Going to wait. Now, can you please raise your leg? Okay. Can you please raise your leg? So for the last part, I'm going to perform the Homan's test, which is used for checking deep vein thrombosis. So what I'm going to do now, I'm going to dorsiflex your calves down and also your foot to check for your calves. Okay. So then I'm going to check for capillary refill. So the both capillary refill is less than 2 seconds. So I'm going to summarize all that document that I'm taking. So all your vital signs are normal, and I haven't found any abnormal findings, and also related to your cardiovascular system. So, ma'am, do you have any questions or clarifications before we end the assessment? Okay, so and that's it for today. Thank you, ma'am, for the cooperation, and have a good day.